Thank you, Jaji, for introducing the backdrop of a suicide and the importance of it in the current scenario, where we talk about the mental health. We talk about a very important aspect of women, how they are looked in our country. I am sure this Sanskrit shloka we all have heard is Yat Narestu Pujante Ramante Tatar Devta. In English, the translation is given of the sloka is, where women are honored, divinity blossoms there, and where they are dishonored, all action remains unfruitful. So women are very important aspect of our society. Unfortunately, when I say so, I am trying to emphasize some of the aspects of the women in the current scenario, in the backdrop of the policy, in the augmentation of mental health challenges, are not as much as they are required. I wouldn't say they are not there. They are not as much there as they are required. So there is a kind of a gap, a wide gap in the problems which they face, in the compensation which is being given to them, and how they have to sail through. If you want me to switch over in Hindi in between, I will do that, and please let me know. Okay. Women and men are different. मेरी टॉक में बीच में आपको थोड़े बहुत ये डिफरेंसेस के बारे में चर्चा जरूर मिलेगी, क्योंकि जो there is saying men are from Mars and women are from Venus. I say it this way: men are always from Mars and women are from Venus. So if you understand the meaning of this, that women are from Venus, you will understand that there is so much of a tender care, passion, life, energy around the resistance. That is where they are supposed to be from two different planets. Differences are going to be there. So let us begin with the differences and then go to what are the challenges. There are physical differences in terms of attributes, physiological differences in terms of vulnerabilities, psychological attributes, some of the resilience, some of the gender predisposition which is different, and gender role very predominantly. How women and men are perceived in the cultural scenario, that is definitely different. एक बहुत साधारण सा आपको इसका एग्जांपल दूंगी कि हम कितना भी सोचें कि बच्चों को परवरिश के लिए या मैन बॉयज एंड गर्ल्स की परवरिश के लिए हमको न्यूट्रल एनवायरनमेंट देना है, which is known as gender neutral environment, where no biases, no predilections, no preferences in terms of bringing up the children. इसकी अवेयरनेस और इसका इम्पोर्टेंस अभी भी इतना डाउन लेवल तक नहीं पहुंच पाता है जहां पर men or rather a male child is given more prominence as compared to the female child. This is a dark reality. Let us not ignore it. Also, we say that we are trying to be equal. This is a reality. And I wouldn't say that this reality in India scenario, this could be a reality in terms of preferential treatment. In the world scenario, it is a reality of some kind of a compensation or some biases, I would say. So this is a fact. How do we go about it? How do we really mitigate this gap? That remains an answer. And that remains the question which we have to answer. So there have been differences well defined, Men are supposed to do certain things and women are supposed to do something. There's nothing wrong in it. अगर आपको बीच में मुझे लगे कि मेरी बात से लगे कि मैं बहुत फेमिनिस्ट टॉक कर रही हूँ तो प्लीज इग्नोर करिएगा. इसमें केवल विमेन मेंटल हेल्थ के बारे में बात की जा रही है, लेकिन हो सकता है जिक्र इतना ज़्यादा है उनके वेलफेयर का कि आपको लगे कि फेमिनिज्म पे बात हो रही है, लेकिन फेमिनिज्म पे नहीं हो रही है, उनके मेंटल हेल्थ और उनके ग्लोबल हेल्थ के बारे में बात हो रही है. तो जब हम मेन की अज्यूम्ड अगर आप कल्चरल रोल में देखेंगे तो एक सुपीरियर पोजिशन बाय वर्च्यू ऑफ डोमिनेंस, by virtue of you can say opportunities, it has been a part and parcel of life that this has been a position which is on a superiority, and then the role of the women is underplayed. So there are certain vulnerabilities which arise out of this preferential treatment. I would say the perceived superiority, because there could be equality in terms of functioning, but the perceived superiority brings a lot of challenges in the day-to-day existence. Now, culturally also, I mean, if we go deep down the eastern, our own country, every 100 kilometers, the culture changes. So if you go further down, we'll find that certain things women are necessarily supposed to do. I'm sure reference can be made to this particular vulnerability in an old Sati Pratha, which was, of course, with great reformations, it has come to an end, and also where the female fetus, there was a lot of deaths much before the girl child was born. In many parts of the country, this was a scenario. I wouldn't name the few states, but there have been a lot of initiatives taken in certain states where this was considered to be taken care of. Now we go further in terms of other aspects of treatment. You'll find that the South is the only culture where there's an inheritance which is patriarchal, matriarchal inheritance. So most of the places in our country is a patriarchal inheritance. Why so, or why it, how it affects is a matter of debate. It gives a dependence on many issues. So equality does not mean it should be matriarchal or a patriarchal. It only means that it should be an equal with both the genders. That is what takes care of discrepancy at the social level, and that takes care of the exploitation at the social level. Now, how women are different? See, mental health has a lot to do with the differences between the two genders, and this is very important to understand how they're different. The way they communicate is different. The way women react to stress is different. I'm not going to say that they're superior. I'm just saying different. So please highlight the word difference, not the superiority or inferiority of any gender. There's an alpha bias. You know, alpha bias is giving a preference, particular this men will behave like this or women will behave like this is kind of alpha bias. And gender neutralizing is known as a beta bias. So there's different vulnerabilities, like because of the custom, because of culture, like dowry system, working, and various kinds of scenarios, the vulnerabilities which are inherent because of socio-cultural background. So a number of theories have been proposed, and they have said that this is how we process information because this is how we have been subjected to discrimination. So this becomes a psychic component of the women to agree and not to differ and to follow what has been said and not to have any kind of problem in terms of it is not reinforced behavior that they should be allowed to speak, allowed to stand for their rights, allowed to do certain things. It is not generally reinforced in certain cultures. This makes the vulnerability much more prevalent. Now, if it was an interactive lecture, I would have loved to ask each one of you, can you tell me how the communication differences exist? But since it is not interactive, I would just dwell in one or two aspects of communication. See, there's a very fine tuning in communication as far as the men and women are concerned. You know, the men are wired differently and women are wired differently. In mental health also, whenever there's an issue between the couple, we always say that look at this inherent difference as to how you relate with each other, which is bound to be there. So let us accept that and move ahead. So what is that which is a communication difference? Women may express more if they are under trouble. They may try to verbalize more. Men may find it a little difficult to verbalize more. Why? Because it is stereotyped that if you share or cry, you're a sissy boy or a sissy man. So this is a stereotype which is not broken. Nobody says that sorrow or sadness affects the men less as compared to the women. It affects equally. However, I don't know why society has given a right for a woman to cry and men not to cry in terms of being a behavior, being acceptable and desirable. So this also is a very important component as to how we communicate. Another very interesting aspect of women communication is they are not very direct in their communication. Say, for example, I mean, this is interesting to know that when we talk about the certain choices when the women discuss, they'll say that so and so has done that and it was really nice. And instead of saying that it was done by somebody and बहुत अच्छा लगा, मुझे भी ऐसा ही करना है, दूसरे का example ज़्यादा बार देने की आदत होती. Now, this certain styles of communication adopted, this makes the life much more interesting to have certain differences. But what happens? How does it affect the mental health? It affects the mental health when there is an understanding of the inherent differences of communication between the partners. So when we talk about any adjustment, we do refer to this particular communication skills, how this differs. Now, I did talk about the gender, and there's a role which has been prescribed about the culture to the particular gender, you know, right from the, if you look at the prehistoric era or so, it was like collecting the food or providing the food, the provider of food was considered to be taken care of by the, not in terms of bringing or earning the food, cooking, making it available to the family was considered to be as a part of tender component of women. This has been there right from the so they were part of that tender care at the homes. Now, what has changed actually? What has changed that remained as a part as it is. It has not changed. What has got added on is their own work contribution outside the boundaries of the house. So what has increased is the work is increased. What was given earlier, or what was supposed to be done by the women earlier, is there as it is. So that's what creates a more stress for the women who are facing life. You see the transition out of the cut. This is a beautiful slide talks about the many performers you see in the top, the scientists who have done well in their own spheres and the various domains of the life, and the women joining armed forces, but women in past, that also the glimpse here. And maybe women, because of some kind of socioeconomic deprivation, still continue to do some kind of menial work at home and domestic help. So, but there is more percentage. I would say, if you look at the percentage, it is not very explicitly high percentage of women working in the current scenario. But there is an increase of women working in the current scenario in the various fields. What has changed, as I told you, what has not changed is that they're the housekeeper, they have to cater for the needs of the as a spouse, they're primary caregiver to children and elderly parents, and very few have worked out of homes earlier. So there's a change of role which has happened. Now, what has happened is, apart from being the provider, caregiver to children and family, there's an added role which has come. That is known as an employee role, the worker sphere, which has got no compromises. So that is why it creates a little burden. So we understand the discrepancy at social level, at cultural level, at environmental level. There could be something can be done to mitigate these kind of discrepancy, to lessen the burden of mental health on women. See, there's a lifespan influences. You see, there's a very cozy picture that happens in most of the houses. You know that this is multitasking is something which bothers the women very badly. They would be processing many things at a time. And I think what is designed for the safety or rather health purposes, they would be having a processes are not multitasking doesn't come very easy to them. Please don't get offended who are the audience or men. But I have already warned you, like you show a picture, you say that there's some scenes going to be very traumatic. So this is one aspect of this in this particular talk where you find that some things appear to be more oriented like as if a feminist talking, but this is not. This is them just talking about facts. So men may not be able to have the multitasking device on very flexibly. Like it may take some effort. The women generally have a tendency to take on many things at a time. Later on, what happens, less it is realized by the women, it creates a lot of health crisis, because this also can lead to a lot of stress-related disorders, can lead to a lot of problems. So this is required to be engaged on. Gender and mental health, when you take a perspective, a certain perspective, like for example, the socioeconomic determinants, which are very important. In terms of financially dependent women may have little difficulty to have an access of the mental health care. The status and treatment of the women in society. I mean, right now in this scenario may not be so frequently witnessed that a women who suffer mental illness in the institutes are then only owned by the family members. I'm talking way back in Central Institute of Psychiatry, Ranchi, in 1988, 90, when we had certain patients who were abandoned by the family. And they were not, especially ladies, where they had not come to really either to know about their health issues and concerns, or not even able to bother to check back. So it became mandatory now. There are not many checks and balances, like you have to have identity, address proof, this, that, and not more than 30 days. Like that, there is a lot of things, practices in place. But it used to be a problem. Like they would abandon in the hospital, in the centers, and the family members will not bother to go back and check about the condition of the patient. It happens to be. So this stigma also around their mental health care, their exposure to particular kind of risk is very much present. Now, there's another difference which I thought is very healthy to discuss about. See, when women have a problem, they might approach people, but when men have the issues, they may not seek help. The help-seeking behavior is a very good behavior. And I think it comes very handy in suicide prevention also. So let us have a little picture of how the percentage has affected them. If we look at the facts of the World Health Organization report of 2001, which was very widely published and researched, which is they talked about the 41.9% of disability among the depressive disorders account for 41.9% of disability in the women as compared to 29.3 among men. So depression is very common among women. At least 1 in 5 women suffer from physical and sexual violence, that is rape or attempted rape in their lifetime. This is a very sad scenario. Whatever the law can do, or as a human being, a society can do, as a citizen, we can do. This is the very painful aspect of women torture anywhere, not only in the country, anywhere in the world. The lifetime prevalence of violence against women ranges from 16% to 50%. Look at the figures; they're so variable and so high. Even mental health problems are really, like for example, they could be depression, organic brain syndromes, dementia, and majority of them are women. So an estimated 80% of 50 million people affected by violent conflicts. This is the rough figure. Now, if you go for the actual figures, so any data, I mean, there's a little difficulty in our data facts and their veracity, that sometimes the problems are there, variability is there, but you get a glimpse of it. You get a glimpse of the intensity of the problem and severity of the problem. So you see, so many of them are affected by the conflict, civil war, disaster, disappointment. Now, there are many common mental disorders which are, women are affected by. Depression and anxiety are considered to be at the topmost in the list, followed by somatic complaints, and unipolar depression is as common as twice as common as in men. And the lifetime risk of anxiety disorders is also 2 to 3 times higher as compared to males. So they are at risk. There are reasons why they are at a risk. Depression is not only the most common problem, but the more persistent in women than men actually. And women are more particularly likely to present the reverse vegetative symptoms. They are known as increased appetite, weight gain, etc. And in case of anxiety disorders, females have greater severity of the symptoms as compared to men, and may have comorbid depression. So things about the anxiety depression are very common in women. Vulnerability arises out of various factors, and the topmost and some of the important factors are hormonal factors and the reproductive cycle. This is a biological aspect where the women become vulnerable to certain disorders, and it can be these hormonal imbalance may affect mood swings, can lead to libido, headaches, night sweats, food cravings, acne, insomnia, tiredness, fatigue, weight gain, so many issues. But they are because of the biological factors. The warning signs when you talk about when should we consider serious enough, when there's something is required to be done, is known as when there is any feeling, I mean, whether sadness continues to be and is persistent. The duration is very important component of having the alert, red alert, that red flags. That if somebody is feeling low and it has been for 2 weeks, 3 weeks, months, there is an important aspect one should really get warned that why it is not going away. I may feel low for a day and next day I may be up and above. I may feel low for 1 or 2 days, not for weeks. If it goes on, it needs attention. It cannot be ignored. There could be a change in sleeping habits or eating habits. That also cannot be ignored. So if you notice that there is a change in person who is significant other or self, it needs attention. So it should be always, help should be sought. And changes of the weight, decreased energy or fatigue. Now this can be a combination of factors, not one. Some of the signs may be present together, and they may be the precursor to the any kind of a mental symptoms. So let's not have stigma. See, I always say that when we have any kind of fever, cold, cough, sneezing, we rush to doctor. But when we feel low, we are not able to sleep, we are feeling sad, we don't go to the doctor. Why? If my body can have an issue, for example, my organ, like for example, my lungs can have a problem, my stomach can have a problem, my any other system of the body can have a problem. Why my brain cannot have a problem? It can also have a problem. And if I know that this is a problem or I am going through this, why not seek help? So the stigma is primarily, I wouldn't say stigma is not there, is there. But more than that is that it is reinforced by certain behaviors of ours. Now we try to say, okay, somebody will come to our do this. Nobody will say, when you suffer, you have to treat yourself. And thinking of what others will talk about it, I must say the awareness is the only weapon which we have to create an awareness. So there is an awareness, and early detection will be there, early treatment will be there, and the people may also consider this could be a part of presentation of any other problem. So we have to really attack head on, and we cannot ignore it. I was just talking about the hormone changes and the depression and other problems, and this slide is also pertaining to that, that because of hormonal changes at various stages of the life of the women, they may go through certain symptoms of depression and stress. If we notice, it can be after pregnancy, during pregnancy, after menopause, during menopause, during menstrual cycle, and this all related with the life, I would say the phase of life of the women. What happens with the working women when they are, see, women in general is a very broad, I would say it covers everyone. It covers the domestic, I mean, lady who is a homemaker, they call it home engineers these days to make it much more comfortable. But I was very happy. I mean, there's nothing wrong. Homemaker has no, I mean, they have much more to contribute than anybody. And not only that, their contribution goes unrecognized, goes unpaid. But homemaker is something where they have their own set of stress. At the same time, a lady who has to look after the home and working, she has another type of stress, and that stress can be arising out of um, uh, levels which are like, for example, guilt of having a children and leaving them. For example, you leave a person, you leave a child, and you go for the job. You feel so bad about it. Then you want to compensate, and then you become super mom. What is super mom? You can do everything, and that is where the stress becomes unbearable. So the women have to think that certain things they cannot do and certain things have to perform. You're not all that I'm perfect and super. I mean, super mom concept or proposition is a very difficult proposition, and that takes toll on the health of women. So that is required to be really taken care of. Divorce is another problem. Now, what happens during the divorce? Well, ladies are always blamed. I mean, if the compromises have to be made, please, I'm not promoting it. I'm just trying to look at the reflections on the problems of the women they have to go through. When the divorce happens, both parties are equally responsible, not one or the other more. And unfortunately, ladies are blamed more often. Now, this also really, I would say that ladies are coming forward because the women are working and they are able to take burden of the care of the child. But that takes a toll on a woman. Because again, mother is assigned to a duty of taking care of a child, and then naturally so, instinctually so. I am not saying that it is not so, it is so. But then what it has done, it has created an added stress. So these are the dimensions of stress in the life of the women. You cannot, we cannot ignore it, and they are real, and she has to face it. Single parent, all the more difficult in our society. So stress arises from various perspectives. Now, what are the various factors which are associated with the risk of common mental disorders? You see that excessive partner in terms of alcohol use somebody is doing. You notice a sexual and a physical violence by the husband. Indian marriages, if you take a survey, you will find, I'm not exaggerating, you will find more than actually 40%, 30-40% women in an abusive relationship and tolerating it as a part of a contract of marriage. Reason could be any. It could be financial, it could be personal, It could be any. I'm not calculating those aspects, but they may lead to some common mental disorders because of this abusive relationships, being widowed and separated. Another aspect. Even having low autonomy in decision making and having low levels of support. I don't know how many of you agree with that, but a decision making uh, percentage of together of men and a woman or a husband and a wife about any particular decision is practiced, and this has been a recent change. But otherwise, decision making was always bestowed upon the person like breadwinner. Since the financial independence movement, the decision making has been become participative. But that also is an urban. I'm talking about that percentage of women who are in the urban society and working. I'm not talking about that percentage of women who still cannot take decisions. And there's a huge number of such women. The another aspect which can lead to risk factors, that is childbirth, then social aspects, as I said, opportunities of employment. See, we notice that women are doing very well. Definitely, they are doing. But when you find the percentage of women in the top positions, the percentage is pretty less. I mean, last I checked was around 14% or 22% or something. So this is as recent as 2 months back, when women in the top positions in the various sectors. And even in the services, I mean, in uniform services, the kind of there's a lot of respect, but the employment opportunities in the private sector elsewhere, people sometimes say glaringly. I had a discussion some time back with a professional colleague that this is a reality. You may not like it, but in the selection criteria, also when it comes to assigning the bigger responsibility, huge responsibility, women are considered less of. I think this is something which is a risk factor in itself. This is a preferential, I would say, treatment and perception. Let's talk about severe mental illness. See, when you talk about in the psychological terms, there are common mental disorders and severe mental disorders. Severe mental illness are the ones which are which lead to a long-term care, more consequences, have a chronic pattern, and they are having a generally have the psychosis in the background. So you have psychotic incidents like schizophrenia, the severe mental. Bipolar disorder is also considered one of them. They differ in men and women, and it is noticed that rapid cycling or seasonal pattern of disturbances are more noticed among women as compared to men. So, what happens if a woman is goes through the consequences which are hazardous health consequences? She has she faces the abandonment by the family, homelessness, sexual abuse, and because of that, there could be exposure to HIV. Now, this is something which is faced as a consequence of being affected by the mental health. So there are two aspects to it. One is what leads to mental illness. Second is what are the consequences of the mental illness. In both, you see the spectrum is social, so much social. So if at all any change has to be brought in, that has to be social and at the policy level. So there could be other infections that can contribute to the problem. The stigma is a big problem. To accept a lady with a severe mental disorder back in the house in some of the educated families also becomes a problem. So this acceptance will come as we become aware and more socially formed, and maybe policies will help it at the social level. So there is a very important component here of social in nature in terms of women mental health and women equal aspects of acceptance at the work sphere and in the society. Suicide, I think we just mentioned in the beginning itself that yesterday was the World Suicide Prevention Day. There is an interesting part of this. Interesting in terms of the occurrences. Attempters are more female in terms of suicide, and male are more completers of the suicide. Girls from nuclear families and men who are married at a young age, they are at higher risk. And suicide rate, if you look at the age in India, it says about that women between 18 to 19 and while in the age group of 10 to 17, the female figures exceeded the male figures. Now, reason could be any, I mean, if you look at it, it appears to be more of a biological changes taking place and social acceptance changes, multiple factors. Suicide is multifactorial, not one. So this needs to be prevented, and it can be prevented. So one another aspect which is about the suicide where we have got enough role to play is prevention of suicide. So large degree of attempts of suicide in the case because of failures, response to failures. Now difficulties in interpersonal relationships. In the women in 18 to 29 can be because of dowry issues, marriage, quarrels with the spouse and parents-in-law, love affairs at a young age, illegitimate pregnancies. This could be some of the risk factors of suicide in this age group, girls and women. Now, the social skill training at the young age goes a long way in developing the problem-solving technique. Our dowry is an issue which is again socio-cultural issue which is handled. And conflicts with the spouse and parents, in-laws, our Indian scenario are very common. For the culture we have of accepting not just one person but the whole family, but it's a two-way process and it needs to have a mature understanding. So understanding from both the sides, maybe from the uh, family the child goes in and the girl goes in, and the girl herself being prepared for the adjustment goes a long way. However, interpersonal disturbance which happens, that becomes a part of stress. And that is why we say that it is preventable. Because you can reduce the interpersonal conflict and disturbance by talking about them, by providing the help, by being aware that this can take a very different kind of a pattern or a presentation of a problem. Because this common causes are, as I said, I think it is covered already. The spousal violence is also very much a risk factor in Indian scenario. All I think previous speakers might have addressed also that during this pandemic, COVID-19, also domestic violence had increased. A lot of instances of increased domestic violence because those who continue to stay together in the same four walls of the house may feel a little more difficult to cope up with it, and this is associated as a risk factor for the attempted suicide in the years, I mean early years. This is very alarming and very, I would say, not a very encouraging scenario. When the figures pop up, they give a very sad scenario of women and the way they are being handled in the society. See, India, it is report talks about that two-thirds of unmarried women in India are victims of domestic. You see the number; it is huge number, and even the 70% married women of ages 15 and 49 are victims of beating, rape, or coerced sex. So I was just talking about number that you put a survey, you'll find 40 to 50%. It goes much higher. So this is preventable. This can be corrected. This needs to be looked in. There's a great need for all of us to be alert and aware what is happening around us in the family. If we see any one of these, there should be greater efforts to reduce and mitigate this. So primarily, if you look at the couple of problems which are there, they're social in nature, they're cultural in nature, and accepting the biological predispositions, like for example, hormonal changes, etc. Victimization is very social, and that is where a big role comes for each one of us to be an educative person and good citizenship behavior. See it around, try to stop it, control it, educate it, and create an awareness. In any kind of way, Women will be asked, did you say no? Were you hanging around? Why are you wearing the clothes like this? These are not the reason enough. Then what happens with the four walls of the house when the rape or the sexual violence occurs? That has got nothing to do with how you dress up. It has more to do with how you look at women, how we are trained to look at them, with respect, with dignity, as a sex object, or as an individual with dignified perspective. This is very much so. So, violence, I think I did mention it, but again, dowry debt harassment, mental and physical torture, sexual trafficking, public humiliation. I think there was one movie which is Urta Punjab. It talked about the drug and sexual trafficking in a very explicit manner. This is dark side of human nature, where the women are subjected to a lot of violence and crime. Working wise, again, I revert back to this. This is quality time for the children to be spent. Working environment has to be seen. Relationship, which is interpersonal workplace, and everything comes in picture when you talk about a healthy life for the women, especially. So families and working wise and the people who are working, it all becomes inclusive, and this needs to be taken care of. I'll go a little bit about the mitigation of stress also, since we are talking about the mental health. And this I've covered. So what is difference? Females have a tendency to fight or a flight, but fight is theoretically untenable. However, they fight is the best, and their attack defense mechanism is empirically unsubstantiated, but the coping is definitely is being proven. So they are not aggressively tenability of fight response, but yes, coping is there. So coping is the one thing which is enhanced in terms of adverse circumstances. Fight or flight, again, when you refer to women and men, this is a slide where this was subjected to a lot of alcohol abuse and in terms of the mood disorders. And I think most of us know that what this actress had suffered. So women very less often hit the bottle. It's the men who, under circumstances, but some of the mood disorders and alcohol abuse is also common. Very interesting aspect of women coping with stresses, tending and befriending. It takes men a lot of effort to go and reach out, but women have a tendency to go and approach for help. So tending and befriending comes very naturally, and it is a protector. So once any kind of distress is there, this should be highlighted. This should be emphasized. Share with others. Reach out to people. Don't suffer alone. Again, stress relief friendship is a buffer. Having a supportive contact, supportive friends to talk about it. There are a lot of things where the things will change when the people find that they can talk about their feelings. So more strong networks of friends and family will take a long way to go. So having a supportive network is essentially a great idea. Now the question comes as again go back to how the men and women differ. You'll wonder, do men tend or befriend? Answer is qualified yes. They do. And paternal caring and male collective activity in response to stress is present. They do also take that. Maybe not reach out for support so spontaneously, but they do tend and befriend during stress. How should we cope up? Remember, you can do anything, but you cannot do everything. So the imposed, superimposed expectation on self is I can do everything. Not for any other reason. You can do anything. That is a capability, but not everything. You shouldn't try to do everything. That brings a lot of stress among women. So we need to work on this. So what is required is to manage coping with the stresses, prioritize. You should decide which part of the life is really important and which part does not need so much of an attention. Everything is not important. Now, certain things may be more important, certain things may be less important. Simplify. Things are complex. Look at simplicity. Share work with children and have a sharing relationship at home. Teach the children. That it starts from home. How they should behave with the ladies or a female child or a girl. Or each mother can teach their children and sons, daughters about the behavior. So this goes a long way. Everything is not to be inculcated outside. It comes from home, that they are equally to be respected. So stress management is also important here. When you say be active, talk to people, don't keep it to self, and there should always be a scope for ventilation. So stress management movement is very important to slow down. Now this is another problem with women have. Keep everything span and everything should be very perfect. So if something is left unmade, it's not important to do everything. Quality time spent is more important than to finish all your daily chores. Take rest. It is very difficult for women to take rest, but force yourself to take some rest. Take a good night's sleep and be a little positive. So when we have talked about so many things that the women have to undergo, they have to invest in self-care as well. Say what we are, we have to respect what we have. The ability to talk, the ability to listen, the ability to hear, the ability to swallow, the ability to taste the food, the ability to experience the world around us is immense ability. And we should be grateful to have this ability. So we have to be happy for what we have, a lot of gratitude, and also a little self-care. Love yourself. Don't try to ditch it by putting a lot of stress on yourself by doing everything possible. What is lacking in this scenario? What we have the policies, gender neutral policies, a lot of help seeking facilities, the public advocacy. These things are very important. And there's a great requirement for the policymakers to fix. So the discrepancy is mitigated. To have the policy for women. There has been a little change, paradigm shift in thinking, a long way to go. So I'll conclude with this beautiful lines of Jaishankar Prasad. Nari tum keval shraddha ho, vishwas rajat nag pal. पीयूष स्रोत सी बहा करो जीवन के सुंदर समतल. It does not mean the expectation. It only, I'm looking the self-care here. That to be quiet and to be silent, to be peaceful, it is important to maintain the sanity of the mind, to invest self-care. Love yourself. You are unique. And no other person can do as many. There cannot be any other aspect of your uniqueness as you have in this, as a composite figure as a woman. Thank you. So before you think of taking any drastic step, always remember you are more precious to this world than you will ever know. So never ever, anytime, take any disastrous step and ask for the help.